The broadcast is now starting. All attendees are in listen-only mode.
Welcome everyone to today's program. I'm Shanna Barnett with Becker's Healthcare. The program will begin with a presentation, and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have, and will follow up on questions we do not have the opportunity to address. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at that time. This email will not include the presentation. It is now my pleasure to introduce today's presenters. Brett Wilson is the practice leader of learning and development at Cornerstone On Demand. He's a seasoned business operations executive who has spent the past 20+ years pioneering major business growth strategies and improving business units for the training industry. His expertise spans many corporate areas with the firm's grasp of essential P&L and client management in support of commercial and government accounts. Brett joined Cornerstone in 2013 as the practice leader for learning and development within the business consulting group. In this capacity, he provides thought leadership to help clients fully leverage and optimize the Cornerstone application and create business strategies to align with business goals and objectives. It is now my pleasure to turn the floor over to Brett to introduce our other presenters today and to begin the presentation.
Thank you, Shannon. Hello, everyone, and welcome to the webinar. For those of you who are not aware of Cornerstone On Demand, it's a cloud computing platform that provides unified talent management services to its customers. That's anything from recruiting to training to onboarding, anything that can be used to assist in the process of transforming talent is the specialty of Cornerstone On Demand. And it's in 2014, Penn State Hershey implemented Cornerstone's learning module as well as its observation checklist. And today it's my great pleasure to introduce to you our speaker, Glen, who's an organizational development specialist with Penn State Hershey. Now, he's going to give you more background about himself, but Glen was part of Hershey's implementation team when they first partnered with Cornerstone. And he's worked with both clinical and non-clinical areas within the hospital to help improve learning, performance, and overall quality programs. So with that, it's my pleasure to introduce Glen Cermak. Glen?
Thank you, Brett. I appreciate the introduction, and I'm very happy to be here. It looks like we have quite a full house. So a little bit of background on me. I'm an organizational development specialist at Penn State Hershey Medical Center and College of Medicine. My previous experience includes healthcare, obviously, public education, banking, nonprofits, restaurant, and retail, but all related to learning, whether it's as a trainer or curriculum developer. I've been in multiple roles, but all related to learning. I myself am quite addicted to learning. I have 3 master's degrees, all related to, all of them focused on how to use technology to improve learning. After my 3rd one, my wife capped me and said I can't have any more degrees. So then I moved on to certifications because I had to find a technicality there. And I got my EIDL certification in IT service management and my Six Sigma Black Belt certification, which has definitely come in handy in healthcare here. Next, I'll give you a little background on Penn State Hershey itself. So we are, as you would guess from the name, located in Hershey, Pennsylvania. And right down the street from us is the chocolate factory. Some days, depending on how the wind blows, you can smell chocolate or roasting peanuts. Unfortunately, we don't get free samples. On our campus, we have Penn State's College of Medicine, we have the Medical Center, our Cancer Institute, our Children's Hospital, and we have over 65 practice sites, mostly throughout central Pennsylvania. And we're quickly growing. We have some great opportunities over the next year or so to partner with some nearby health systems that I think should help us grow and improve our learning that we're going to talk about today. We serve roughly 1 million patients every year, and we've been with Cornerstone for almost 2 years. We went live January of 2014, but we were signed with them in, I believe it was July of 13 we signed and then worked through implementation. And as of right now, we have roughly 14,000 users on our Cornerstone implementation. All right, so today we are going to talk about engagement, its impact on healthcare, and how Hershey is trying to ensure that we keep our employees engaged, especially when it comes to learning. So just some quick facts and figures here. A recent study found that less than 44% of healthcare employees are what would be considered highly engaged in their jobs. And that's a problem because we know that higher engagement leads to things like lower turnover, greater efficiencies, which can lead to greater savings, and most important for those of us in healthcare, improved care for patients. And you can see a quote there from a 2012 report that said that findings show a high level of employee engagement is directly related to retention, patient-centered care, a patient safety culture, and employees' positive assessments of the quality of care and services provided by their team. And all of those things are things that we want in healthcare. We want to provide the best possible care we can for patients, and we want our employees to be happy. So we need to make sure that they're engaged. On the next slide, we'll see this is from another study, but this summarizes what factors come up most often in terms of what employees in healthcare-specific roles need in order to be engaged in their job. And I'm not going to read through all of these for you. Here at Penn State Hershey, we take an employee engagement survey to find out how we can help to ensure our employees are more engaged. We just took one in the fall, and we've been working on action planning with all the departments on how to address different pain points. And in 18 months, we'll take another employee engagement survey and we'll compare the results and see where we've grown. So all of the areas identified here, again, I'm not going to read through them all, but the big categories there: career development, leadership, supervision, goals and objectives, workload, stress. One nice thing, at least for me in my position, is that learning can actually address all of those. To some extent, learning can help with leadership. It can help with supervision. It can help with career development. It can have an impact in all of these areas where our employees are saying, we need these things to be a more engaged staff. So what we did at Penn State Hershey is we decided to look at our learning. And on the next slide, we went through and we said, okay, what do we want out of learning here at Penn State Hershey? Well, we wanted retention and application. So we wanted people to remember what they learned and apply it when they're actually working. We wanted interaction. We don't want just somebody standing in front of a room lecturing, and we don't want to just send out a PowerPoint and have somebody read it. We want some type of actual interaction going on with our learning. We wanted there to be an initiative and a sense of ownership of the learning. And that's on both the part of the learner, where they're actually going out and trying to learn new things and ensure that they're competent in things on their own, But we also wanted there to be a sense of ownership of the learning on the manager side, where the manager understands the importance of the learning, makes sure that their employees are learning, and follows up with their employees on what they learned. And finally, we wanted to see an impact on the patients and the business. From talking with nurses and doctors on a daily basis for the last 2 years, it's clear that the better the training, the more retention they're going to have, the better they're going to remember what they learned. The better they remember what they learned, the more comfortable they're going to be when they're performing a procedure or using a piece of equipment, even if it's just going and hanging an IV bag. They're going to feel more comfortable if they've had proper training that they remember. And if they feel more comfortable, they're going to be able to provide better care. They're not going to be so focused on those minute tasks, the step-by-steps. They're going to follow them. They're still going to ensure the quality of the care and the safety, but they're going to be able to make that connection with patients that we need in order for patients to really feel comfortable, really feel satisfied in their experience in our hospital. Excuse me. So what we wound up doing is we moved from that stand and deliver where it's a lecture or from a PowerPoint posted somewhere for people to read to a true blended approach to learning. And I'll get into details of that as we go through here, but what we saw was better retention. We saw more collaboration in our training sessions. Myself, as an organizational development specialist, I do some trainings, some in-person trainings, and we've seen a shift from the teacher or trainer role more to a facilitator role, facilitating discussion among peers, among coworkers. We've seen improved satisfaction through the evaluations of our programs and through the demand of our programs. We used to have to advertise to get people to sign up for some of our programs. Now we're getting calls because somebody went to a session a few months ago and there aren't any new sessions of it listed and we want to go. And so we're seeing increased demand. We actually have people coming to us wanting more and more training. We have improved engagement before, during, and after training. So you'll see as we go through this that we've paired a lot of pre-work and post-work things with a lot of our trainings, and that's to ensure that they stay engaged. They prepare for the training. They don't just show up that day. And when they get there, they're engaged during that session. They're participating. They have things to share, things to discuss. And then after, we have follow-ups and checklists that Brett had mentioned. And then we also are seeing improved implementation of the learning. We're seeing people actually going out onto the floor using the tools and the tactics that we reviewed. They're implementing them, they're putting them in practice, and they're making a difference. So there are 3 types of learning, or at least I tend to group 3 types of learning here at Penn State Hershey. So there's onboarding, required training, and personal or professional growth. And each of those are a little different. Onboarding is required training, but it's a slightly different atmosphere. We're trying to get everybody into the organization. Required training, healthcare is well aware of required training, and I even have a few little subcategories under required training. And then personal and professional growth is more of what employees are going out and taking on their own, that they want to do these trainings. So I'm going to talk about each of these as we go through. We'll start with onboarding. So we reworked onboarding, and we have a tiered approach to it. And we went with that because of we have sort of a cascading goals structure. as well, where the organization has strategic imperatives like ensuring that we provide the best patient experience possible. So then there are department goals, like the Department of Nursing will have goals that will help the organization reach its goal. And each unit within the Department of Nursing has goals, and each work group in those units has goals, and each individual in each work group will have goals. So the goals cascade down. So we did the same thing when we set up our orientation. So we have hospital orientation, which everybody goes through, and then they're moved to a department orientation, and then a unit orientation. And the hospital orientation, it includes, a lot of the big topics that you would expect, a welcome message and a history of the organization, some HR-related topics, IT, security, those sort of things. And then on the next slide, we'll see when it gets to the department and unit orientations, we had never been able to do this before, at least not seamlessly, before we implemented Cornerstone. So what we have are curricula, and each curriculum is specific to a department or specific to a cost center and a job code. And you can see a screenshot there. So we have an orientation curriculum for an ED-RN, or we have a curriculum for a MICU-RN for orientation. And we're able to assign those automatically as soon as somebody is hired. As soon as they're entered into our HR system and they're in that job code within that cost center, they get their orientation. So if you're a new employee at Penn State Hershey, on day one, you'll be assigned hospital orientation. That'll be a two-day live course with the welcome message and all of that. There'll be some supplemental e-learnings on different topics. There'll be some resources for you. All of that's going to be assigned in our learning management system. You'll also be assigned a department and a unit curriculum based on your job code and your cost center, which will be much the same. It'll have e-learnings or live events. It just varies by position and what the requirements are. And we're able to target those even if there's a single course that we want to send out to just staff nurses or just nurse managers. We have over 600 different groups in Cornerstone created, so we can target all of our trainings. We can say, okay, this training we need to get out right now to nurse managers in the SICU, and you can see there we have groups. I can send something to all of the SICU, or just the clinical head nurses, or just the nurse managers. And that not only helps us as trainers get the information out as quickly as we can to the right people, but it's also much more satisfying for our employees because the training's being delivered to them, and it's training that is only applicable to them. On the next slide, we'll see some information about how we onboard leaders. So when a new manager comes to Penn State Hershey, or if somebody's promoted from a non-manager role to a manager role, a whole process is started. And again, automatically using the job code, as soon as somebody hits a job code that is a manager, they're emailed a welcome letter. Welcome to your new role as a leader at Penn State Hershey. And it outlines things for them to do over the first 6 months of their time as a manager. You know, you need to get access to approved time cards. You need to meet with your HR business partner, things like that. They're set up with a meeting with their business partner for an acclimation where it's a facilitated discussion between the manager and their employees about expectations. Employees are able to ask questions of the manager anonymously through the facilitation. And they're assigned a curriculum in Cornerstone. And the curriculum contains resources from major topics. We have a finance resource on budgeting. We have security resources, things like that are all specific to managers. So who do I contact if I have questions about this topic? We then also schedule them for what we're calling Meet the Experts Expo. So we used to have these experts from finance, from we're magnet designated, so our magnet director, from compliance, from HR, all attend these live sessions where they would sit for 4 hours, 4 Fridays in a row, and hear information that is important for managers to know from all these different presenters. And what we did is we changed that to an expo format where we have a room with tables, they go around, they meet one-on-one with these experts. The important thing is that they get the basic information and they have a face. They know who to go to with questions. So we're still able to do that. We also then bring them to the certificate program. The certificate program is unique because it's made up, this is where we really start to bring in our blended approach. So there's 5 live sessions, one of which is sort of an immersion learning where they're kind of thrown into a skit on leading lawfully. We have pre-work and post-work e-learnings depending on the session, so that when you come to the session, when a new manager comes to the session, all the new managers in the room are on the same basic playing field when it comes to previous knowledge on what the topic is that we're going to be discussing. But then we also have these checklists, and these observation checklists, essentially they're follow-ups. So the new manager, their supervisor, goes into Cornerstone, and they sit down with the new manager and they meet with them, and we have 4 or 5 things that they should discuss between sessions. What did you learn? How are you going to implement these things? How would this impact your leadership? What type of goals do you have? Not only does that help the leader to guide this discussion, but it ensures that they're taking this knowledge right from the live session that they just attended, and they're really thinking about, they're really considering how to into action. And then at the next session, when they come back, we start out talking about how they implemented something. So they're immediately able to start sharing and talking about best practices before they're even out of this certificate program. All right, so the next slide gets into required training, which is, I'm sure, what the majority of healthcare trainers are involved in. And again, we tiered it. There's annual hospital training, department, unit, and there are some individual required trainings as well. And on the next slide, just a few topics, safety, compliance, HIPAA, and then accreditation and designation required trainings to keep our accreditations. The difficult thing here is to keep both the learner and the manager engaged during this process. And we've gotten a lot better at this, and it's largely because of a lot of the things we've been able to implement in Cornerstone. So I'll go through a few examples here. Before I get into the examples, I want to talk a little bit about these checklists so you have an understanding in case you haven't seen checklists in Cornerstone or a comparable service in another provider. Essentially, it allows you to rate both learning and observable competencies easily. You can set the rating scale, whether it's just yes or no, they did it, whether it's rating them 1 to 10, however you want. And they can be observable competencies, so yes, they properly inserted an IV, or it can be learning related. We have different competencies by role and by unit. The competencies that we have for an RN in our Heart and Vascular Institute are slightly different than our competencies for somebody in women's health. There are some standard across all of nursing, but there are obviously differences based on what their role is. We're able to have various validators depending on the checklist. So we train 10% of each unit to be validators, plus their nurse manager and their nurse educator. So we have multiple people that can get in and mark off these checklists. What's really nice is they're able to do this on the computer, so it's paperless, but they're also able to do it on mobile devices. There's a great app that makes checklists extremely easy on mobile devices. So we've seen an increase in actual completion of the checklists because it's easier for them to get marked off now that it's on every computer and on your mobile device. We also tie these back to learning opportunities. So if somebody scores low on a particular item of the checklist, we can have it automatically recommend that they take these remedial courses that are in our catalog, whether they're e-learnings or it recommends that they attend a live session. We're able to do all of that seamlessly through these checklists. And we also use it to evaluate the learning. So if we're seeing, we can run reports and see that there's a consistent break in a particular item on the checklist that almost across the board people were scoring poorly on, even though we trained them. Well, now we need to look at the training. Maybe we did it wrong. Maybe it didn't sink in. So we can reevaluate our training, not just be evaluating our learners. And on the next slide is just a screenshot of part of a checklist for one of our RNs. You can see we have pain audits, bedside shift reports, properly using quality control test for a glucometer. I have no idea what that is. I'm not clinical at all, but so you can see it is literally a checklist. We can group them by category, and it timestamps them. It puts the name of the validator and whether the person was competent or what other rating they may have earned. So it's easy to read, it's easy to complete, which has helped us to ensure that we have a high degree of completion on these. Our nursing competencies are probably the most complex because there's hospital requirements, Department of Nursing requirements, unit requirements, individual requirements. So what we've done is we tried to make this simple for managers. We found that managers became very disengaged with the whole learning process of their employees because they found it hard to track anything. So using curriculum, we can group all these courses together and assign it to our nurses. We've seen that. But we also can do a single report, including their observation checklists. So a manager can run one report on an individual employee or on their entire unit, and they can see who is done and who is done with which courses and which competencies. They can even schedule the report. They can say, I want this report to refresh every Friday. And they can schedule it to be emailed to them. So every Friday at 3 o'clock, they can get this report emailed to them as an Excel document, and they can easily see who on their staff has completed different trainings and different competencies. Another example of required training that we've been able to successfully roll out and keep our employees engaged throughout is our security. We had 2 modules, preventing workplace violence and surviving an active shooter situation, neither of which are fascinating topics. We signed it out to all 14,000 users, and after 60 days, we had 97% completion, which I have never seen in another organization. And what allowed us to do this is we created custom reports for our managers. They were automatically emailed out. At first it was bi-weekly, and then it got weekly once we got closer to the deadline. But it allowed for easy follow-up. It listed all the departments, what percent they were currently at that week for completions, so what percent of their employees had completed both trainings. And then there's another tab where it lists all the employees, their department, their position, their manager, their email address, and whether or not they've completed the training or not. So we can easily filter it by people that have not completed the training, and we can send them a follow-up email. Another example would be we are one of the 55 hospitals, I think it's 55 right now, that is designated as a CDC Ebola treatment center. And for those of you that have gone through this, I was looking through the registration, and I know there are several on the webinar that went through this designation. It's a lot of training, and it's a lot of just-in-time training. And we were able to do that targeted to the position based on the plan that we have, where patients with Ebola-like symptoms would be treated. So we can target it to just our ED staff. We can target it to whichever unit we're going to be housing those patients on, patient transport, and we're easily able to continue the ongoing training that we need to keep this designation and track that. So we have our nursing education department can easily run reports and make sure that everybody who's part of this plan is kept up to date and is completing the mandatory education to keep our designation. The other big designation that we have training requirements around is trauma, which will be on the next slide. So we are a level 1 adult and a level 1 pediatric trauma center, which comes with a whole other set of annual training requirements for our clinical staff. They need a certain number of trauma hours. Depending on where they work, those may need to be adult or geriatric or pediatric. So what we've done within Cornerstone is create custom fields. And these custom fields aren't just great for us on the back end because we can easily see, I took a screenshot there of some of the ones we have for nursing, and it includes trauma hours or safety hours, stroke hours, all sorts of different specific hours. So we can easily track those. I can run a report and see who all has completed geriatric trauma hours. But our staff is able to see all this too. They're able to know which trainings they can take to get credit for different things. So it's made it much easier for our staff to ensure their compliance as we go through these different accreditations. The last safety or required training topic, collapsing and CAUTI prevention. So about a year and a half ago, we had a big push, and we attacked this from multiple angles. We got some new products, new procedures, policies, changed our patient education, but we also focused a lot on our learning. And we took a 5-prong approach, you can see there. There were live trainings, there were e-learnings, there were resources available on demand. We had checklists, and we also had simulations. We have a simulation center on site in the College of Medicine, and we put our staff through simulations on how to properly care for central lines and catheters in hopes of being able to decrease these 2 different types of infections. And as of right now, we're actually ranked 1st in CLABSI prevention, 3rd in CAUTI prevention, and 3rd in overall safety among all academic medical centers. So something stuck. Same with patient experience. We're attacking it the same way. we're using the same 5-prong approach. For simulations, we're actually bringing in actors, volunteers, who will play a hostile patient or a hostile family member and put our practitioners, our nurses, our doctors, our residents through simulations of how to calm down those, how to do service recovery, how to effectively communicate with patients. And we're using e-learnings, we have checklists, and the checklists we're using are cross-functional. Like in the emergency department, we have nurses validating that physicians are using this communication protocol, and we have physicians validating that our ED techs are using communication protocols and teaming activities that we've gone over with them. So we're able to make sure there's follow-up and make sure there's follow-through with all these different trainings. The last type of training that I listed was personal or professional growth. And the first thing that we needed to do was to make it easy to navigate our learning management system so that people can actually find training. So this is what our welcome page looks like. It's user-friendly, it's easy. That safety banner there actually rotates. There's 4 little dots there. It rotates through 4 different banners, 4 major topics at the time. There's big buttons there. It's tablet-friendly. There is the mobile app as well that allows learning. So we've tried to make it simple to navigate. You know, down the right-hand side, they can search for a training, they can browse for training, they can look at a training calendar to see any training offerings offered across the entire campus. Next slide. So in the learning management system, we organize our clinical offerings by system rather than by unit. So cardiovascular or respiratory or things like that, because it doesn't matter if you're on acute care or if you're in the Heart and Vascular Institute. Cardiovascular care is cardiovascular care. There certainly will be specific trainings, more advanced ones for the Heart and Vascular Institute, but this way, if somebody is interested in learning more about cardiovascular care, they don't have to go digging through different units that have cardiovascular care. They just go to that system. We've also integrated with lynda.com, so we can offer lynda.com courses in our catalog. We can attach post-tests to them. We attach checklists to them, so if we offer a communication course for managers, we can attach a checklist to it to make sure they're actually following through with implementing the things they learned. Certificate programs, much like the new leader certificate that I talked about earlier, we have one for emerging leaders, one for existing leaders, one around patient experience, and those are all totally blended approaches. And we're able to make recommendations for learning opportunities tied to performance ratings and tied to checklists by having all this integrated. And our last slide, or next to last slide, what's next for us? What are we working on now? One of the big things is expanding our library for personal development. Actually, Cornerstone just announced today that they are collaborating with TED Talks to bring that content into their systems. So I've already requested a demo of that because I love TED Talks. We're expanding our mobile offerings. We're also partnering with a local Penn State University campus here, Penn State Harrisburg, to see what all we can offer together. And we're creating an on-demand library for managers around team building, communication activities, things like that that they can work on with their department. And we're also exploring social learning, which is another offering that Cornerstone has through their system, through their Connect cloud. And we're exploring how we can use that to allow staff to share resources, you know, say, hey, I read this article, and share it with them and comment and really get a collaborative learning culture together. So that's the direction we're headed. I guess we'll open it up for questions. I did put my contact info up here just in case you have any questions that we're not able to get to, or if you think of questions later, feel free to get in touch with me. I'm happy to answer questions or provide resources or anything I can do to help.
Thanks,
Yeah,
Glen.
thank you, Brent. Oh, go ahead.
Thanks, Glen. Excellent presentation. I just wanted to share some questions that we saw coming in the panel. And the first, I believe, was around the time you were talking about new employee orientation. And the question is, how do you track those debrief conversations to ensure that they're taking place?
I'm sorry, what was that?
It's how do you track those debrief conversations to ensure they're taking place? I think it's in reference to the observation checklist when you had mentioned that.
So observation checklists, you can run reports on those just like any other training item to ensure completion. And what's nice is when you run a report on them, it doesn't just tell you whether it's done or not. It tells you all of the items on the checklist. They're listed horizontally across the top of the spreadsheet, and it tells you whether each person who has been assigned to that checklist has completed each item on the checklist. And only the person's manager or whoever is a designated validator for that checklist can go in and mark them off. So employees can't go in and mark themselves off saying, yes, I talked to my manager about this. Instead, the manager actually has to go in and say, yes, I talked to my employee about this, or if it's, an observable thing on the floor, a validator or a nurse manager needs to actually go in and say, yes, I observed Nurse Susie inserting an IV properly. So we're able to then schedule reports to be run to check to see who has completed different checklists within whatever the required timeframes are.
Terrific. One of the other questions around the observation checklist or in general was about the app. I think I can answer part of the question. It's a specific Cornerstone application, but on the mobile devices, what's your sense of acceptance, Glen, by everybody when they use the mobile app?
The checklists are incredible. I honestly think the checklists are easier on the mobile app than they are on a computer. When it comes to mobile learning, like e-learnings, it really depends on how the learning was developed, whether it is appreciated by the learner when they're taking it. Mobile learning, it needs to be much shorter bursts. You need to make sure that it's much easier to navigate than on a computer because you have a much smaller screen, limited space, limited battery power. A lot of them, they might be just doing it on the shuttle between campus stops or something. So we've had great feedback, especially around the mobile checklists. And like I said, one of our big pushes coming up is to expand our mobile learning, but that's going to require us to sort of revisit some of our trainings to make them a little bit more mobile friendly.
Glen, another question. Do you have quantitative measures of the impact of increases in employee engagement? And if so, can you share what those are with us? What's the difference?
So it varies by area, and there are so many different factors that go into employee engagement. There's 36 questions or something on our survey. But through the changes in learning, we can see increases in our employee engagement scores when it comes to things like managers making investments in my future, or if we're targeting, if we see on the employee engagement that we have areas that score low on communication and we target those with specific communication related trainings, whether it's the manager or team building, we can see increases since we are taking our surveys 18 months apart. and it's the same questions given to every single employee, and we break it down by cost center, so we're able to see the impact on specific units depending on what was rolled out there.
Okay. So you've got a good sense of the pulse of the organization as to what's working and what isn't.
It's a whole lot of Excel spreadsheets.
Glenn, this question, I just think everybody, I think it's a great question. How do you drive management acceptance and adoption for, you know, a new system and this different approach to learning that you've taken? Can you tell us a little about that?
So when it was a very mixed reaction when we first went live with Cornerstone. We previously had actually been using sort of a mishmash of different systems. We had safety training on one system and compliance on another, and a lot of our clinical areas, they had their courses on Moodle. So it was a big mess. So one of the big advantages that we were able to sell was everything's in one place. We immediately recognized with our managers, you have a lot of work to do, but keeping up with the training, ensuring follow-up with training, all of that, it does fall under the manager role. So we went to the managers, we had focus groups, we found out how we can make it easier, what are your pain points, what do you like, what don't you like, with the way things have been, with the way you've seen things in other organizations, and we tried to simplify everything. That's why we tried to make sure we got a system that we could generate a single report that shows all of their compliance and annual requirements all in one report. They don't have to run a report on each training or each person. They can just run it on their whole staff and see who's compliant and who's not. So it was really the biggest sell for us, the biggest win was being able to simplify the manager's job.
Perfect. Another question, is your learning and development function centralized or decentralized? And a follow-up to that, regarding the configuration of Cornerstone, can you kind of describe how you address your different business units and configure for their needs?
Sure. So I'll start with first. We have a central learning and leadership development department in human resources. That's where I sit. However, that is largely around, you know, leadership trainings, communication, your general HR sort of topics. We have a nursing education and professional development department that deals with a lot of the more clinical trainings for nurses. We have a physician education area. We have technology educators that focus on training around technology systems that we have, especially around our EMR. So it's sort of centralized, but it's centralized based on topic. So it's kind of a mix of both. In terms of how we run our Cornerstone implementation, we have a Learning Management Council that has stakeholders from each group. There's folks there from HR, from nursing, from our medical group, from our technology education department. And essentially, we meet every month, and as there are updates to Cornerstone that we can either turn on or off, we review them as a team, we decide the pros and cons for each of our areas, and we make a decision as a group. So the actual training that is offered is sort of decentralized, but the governance of our learning management system, of our Cornerstone implementation, is around this Learning Management Council.
Good. Glenn, final question that I see in the panel. How intuitive or easy is it to build custom reports? And is there a big learning curve for that?
I did not find it difficult at all. I will say that I have had to coach different managers on that that aren't as comfortable with technology. Essentially, if you're comfortable with Excel, you're going to be comfortable building custom reports. It looks a lot like Excel. It has cells going up and down, and across the top where you would find, header cells. You can just type in essentially any field that's in the system. If you want it to populate with first name, you just type first name. If you want it to populate with the training title, you type training title. So any field that's in the system, you can add as a column or as a row in custom reports. And there's a tab there for scheduling, so you just click on scheduling and you can schedule to run however often you want. You can check a little box to have it email it to you. I found it to be very user-friendly.
That's great. I did have another question pop up. Who does your engagement survey?
We use National Research Corporation. We use them both for our patient experience surveys and for our employee engagement, which is nice because then on the back end we have correlations between questions on our employee engagement survey and our patient experience, so we can see where, statistically anyhow, if you improve in this area on patient experience, or if you improve in a certain area on employee engagement, you'll see an impact on patient experience as well.
Perfect. Just as a general comment, a lot of questions have come in asking, can we get a copy of the presentation? And the answer is yes. In about a week, we'll be sending out a copy of a link to the recording and a copy of the slides. So everybody on this call will have benefit of rewatching it and also looking at the slides as well. Looking to see if there are any more. How do you tie patient experience to the LMS in a measurable way? Now we're getting to patients.
So patient experience, we actually just brought on a new administrative director of patient experience midway through last year, towards the end of last year maybe. And we're really rolling out a lot of the patient experience related trainings now. Because of a lot of what we're doing related to patient experience is training. It's a training around communication models and around service recovery and things like that. What we're doing is we're looking at a unit's patient experience scores through NRC, and we're rolling this training out unit by unit. It's not hospital-wide. We frankly don't have quite enough staff to do that. It's so intense when we're in each unit doing the simulations and everything. So we're able to compare the monthly reports on patient experience survey results in the units that we've worked and see, is it making a difference? Are they getting it? Is communication between doctors and nurses still a problem? Is communications between a nurse or a doctor and the family still a problem? And then we can go back and readdress that with additional training and support. But we really do it on a unit-by-unit basis based on our patient experience scores for that unit.
Glen, that's great. I want to thank you again for a very informative hour of your experience using the platform, Cornerstone platform at Penn State Hershey. We're coming up on the top of the hour. Shannon, if you can advance to the next slide, please. I have 3 slides, folks. I just wanted to take the great comments that Glen has shared about his experience. And I wanted to share with you from a Cornerstone perspective, when we engage with our customers, particularly in the healthcare field, because this is very applicable, we try to work together and partner to assess where your hospital or your organization is in terms of the operational to strategic spectrum. At the bottom where you could, and it could be some combination of this, of get it done, to a growth stage where you want to be consistent, to where you're expanding, perhaps acquiring other hospitals, going through the alignment, full alignment within the organization, and then into some form of transformative stage. Next slide. Now, what we've talked about today is learning and the observation checklist that Penn Hershey is using. Just to share with you, Cornerstone is a unified talent management platform. So it goes anywhere from, it has separate modules for recruiting, learning, performance, compensation, and succession. And you'll have this slide. I don't want to walk you through all of it, but using that same operational to strategic spectrum gives ideas on where you are in a particular area of unified talent management. Next slide, please. Can you advance the next slide, Shannon? There we go. And so this is how we tie it up. When you look on the left, it's kind of a self-assessment or combined assessment of where you are on an operational to strategic spectrum. And this assessment helps us at Cornerstone really understand not only where a particular organization is in terms of their maturity of human capital management, but also where an organization seeks to aspire to. Oftentimes, shifting a system, be it learning or other talent management system, is a great opportunity to re-examine your current processes and perhaps make decisions about ascension to higher level. And I just wanted to share these 3 slides, as this is a typical approach that we use when we initially engage with customers, kind of help sift out and define where they are and where they want to be. With that, I want to thank you all for participating in today's webinar. And Shannon, I'll turn it back over to you, please.
Wonderful. Brett, Glenn, thank you so much for your excellent presentation today, and a big thank you also to our audience for participating. We really look forward to having you join us for future webinars. This concludes today's program. Everyone have a wonderful afternoon.